In this video, I'm going to be talking about TPR, temperature, pulse, respiration. These are three of the vital signs that are essential for nurses to know about and to know the normal values of, and that I'll be doing every day when I'm in placement and when I'm a qualified nurse. So I'm just going to go through them quickly for you. Temperature. A normal temperature is about 36 to 37.5 degrees Celsius. This is a very narrow range because the cells in your body cannot cope if it goes under or over that degree Celsius. So it's important that temperature is monitored so that the cells and your body can function at the normal rate and the best it can. So there are four main places that you can take temperature. Axilla, that is under the armpit. This is often done in young children, but that might be, you might need to hold their arm in that. It's not the most accurate one, but it's a good one, and many hospitals have that form of taking temperature. Tympanic. This is the one of the most accurate and well-used temperatures. This is a temperature that goes straight into your ear and through infrared light measures the temperature, your core temperature, what your temperature actually is. You also get oral temperatures, which you get temp-dots that you place under the tongue for about a minute or so, a minute or 2 minutes. Take them out and that records the temperature again. That's not always accurate and it can't be used for children under 5. The other one is rectally, through your rectum in your bottom. This isn't used very often, but might be used in paediatric intensive care units or any intensive care units. Some of the terminology that you might use when coming across temperature is pyrexia. This is a high temperature. Hypothermia is also a high temperature. Note that it's hyper, not hypo. Hypothermia is a low temperature. This could be caused by drowning or just generally cold. Babies and elderly people are specifically at risk of this. The next one, TPR. P, pulse or heart rate. And this is measuring how many beats your heart does per minute. So in an infant or a child under 1, it's usually about 120 to 160 beats per minute. In a child, it's about 70 to 110 beats per minute. And in an adult, and this could be like a child of 14 if they're big enough, or a child over 16 definitely, it will be about 60 to 100 beats per minute. So, where do you take pulse from? The radial pulse. This is a pulse that's quite common on your wrist, on the outside along your radial artery. Have a go and see if you can feel it. I'm sure you can. I can't really do it so well in here. It's about here, on the outside of your arm. That's one that's commonly used in taking normal vital signs. You also have the brachial pulse. This is one on top of your elbow, and it's on the inside of your arm. So where your radial is on the outside, your brachial is on the inside. This is used to measure blood pressure when you're doing all manual blood pressures. You'll be listening to your brachial pulse. Should be able to feel that one as well, but you might have to put your fingers deeper in because the artery is a bit deeper. That's often used on babies as that is quite a strong pulse and an easy one that you can use. The other one is apex. This is directly on the heart. This is used by listening through a stethoscope. Carotid, that is in your neck here. I'm sure everyone's felt that pulse before. You also have your femoral pulse, which is in your pelvis, which that pulse isn't used too much. You also have your pedal pulse, which is in your foot, but again, that's not used so much. The terminology, so tachycardia is where your heart is beating too fast, and bradycardia is where your heart is beating too slowly. So, finally, respirations. These are how many breaths you take per minute. Now, this can't be measured if the person knows that you are taking their respiration, because once you start knowing, you start not being able to breathe and think, oh, am I breathing properly? So usually this is done when doing the pulse, and again this has to be done for 60 seconds, a whole minute, none of that 15 seconds times by 4 or 30 seconds times by 2. It has to be done for 60 seconds. So a lot of people are on the pulse for 120 seconds, but only will measure the pulse for 60, and then they'll be doing the respirations without telling the patient, and they'll tell the patient afterwards. That is one of the best ways to do it. Or just when you're documenting, just looking out of the corner of your eye to see their chest rise and fall and how many times that does per minute. So in an infant, child under 1, it's about 16 to 20 respirations per minute. In a child, it's 15 to 25, and in an adult, it's 25 to 40 respirations per minute. The terminology for this is tachypnea, is increased respiration, and bradypnea is decreased respiration, not breathing often enough. You also get with breathing, laboured breathing and difficulties in breathing, but I'll do that another time, and I'll do another video on blood pressure as well. So I hope that was helpful to you. Alright, thanks.